Hey guys, Dr. Schulte here. Today I wanted to walk you guys through what an activator adjustment looks like. So we're using an instrument called the Activator here. So I know a lot of you out there have questions about chiropractic. You may be interested, but you don't like the twisting, turning, popping. It can be kind of intimidating. So I just want to show you how easy it is for the patient to get adjusted. We have Rachel here today. So thank you, Rachel. You can wave with your hand movers. So I'm going to walk you through Rachel's adjustment. And before we do that, I just want to bring you over here to the nervous system chart that we have. So the whole reason I adjust the spine is because it's housing your spinal cord inside. Your spinal cord is really what the brain uses to talk to the rest of the body. So this chart lets you know all the organs and tissues that nervous system is communicating with. So we have areas up here that can affect headaches, migraines, insomnia. We've got thyroid issues, digestive issues, hormonal issues. Over here we have stomach, lungs, heart. So really our whole goal is to make sure that brain is talking and communicating with the rest of the body without any interference. So if you want to look over here, what we're doing is I'm going to assess Rachel's spinal cord here, and we're going to be doing different neurologic checks to see where the body is being interfered with. So Rachel comes in on a regular basis, about once every other week. Most of our patients on a wellness basis are once a week or once every other week. And so we're doing that to optimize the health of that body. So the first thing I'm checking for down here is her heels. So if you want to look here, Rachel, you can see that we're off here. So we've got a little bit of tension going on in that spinal cord. And based off the checks, the first area that needs to be adjusted in Rachel's case is way up here. So the brainstem is the most important area of the spinal cord. So we're just going to do 2 quick clicks, and then we're going to come back down. And the nice part about this technique is we can post-check to see how that body responds, and you can see that those heels are perfectly clear now. And that shows me that nervous system is clear. So we cleared out that piece. Now what we're going to do is assess the spinal cord all the way through. And we're going to start by just having her put her hands in certain positions. So if you could put your left hand on your low back. We're going to start with that low back there. And you can bring that hand down, Rachel. So this area can affect, for women, cramping, hormonal issues, things like that, digestive issues, any pain in the low back or down the legs can be affected there. This hand on your low back for me. And both hands on your low back. So we're kind of working our way up the spinal cord. We'll bring both hands down. I'll have you bring your left hand up by your head. Now we're working up to kind of the base of the rib cage. You can bring that hand down. She did have some involvement right here. And this area goes to, again, digestive system. You have some branches off that area that go to the liver. Sometimes you'll see me kind of work this area. What we're doing in essence with the adjustment is we're clearing the nerve interference with the instrument here, and then after that, sometimes I get in there and I really work the muscles. So sometimes you'll have tight muscles that are just hanging on. In essence, what we're doing is re-educating that body to not have to hold on to that tension anymore. Feels really good for the patient too. So both hands up by your head, we cleared that. Both down by your side. I'm going to have you turn your head to the right side so you can smile at the camera there. And so now we're working our way, head back to the middle, our way up to the stomach. So a lot of people we've helped with digestive issues, stomach issues, acid reflux, pain in the mid-back, all of that can be affected here. But again, we're kind of getting into this. Her body's wanting to hold some tension there. I'll have you turn your head to the right side again. We're going to raise this shoulder up towards the ceiling and back down. Have you shrug both shoulders and relax. So now we're up into kind of the heart-lungs area. Shrug and roll both shoulders. And she's carrying a little bit of tension here. Head back to the middle. And so this is a really important area as well. This area goes to down the arms. So if you have any tingling in the arms, pain in the lower neck, again, this can affect lungs, heart. So if you have some energy or adrenal fatigue, a lot of times there's interference going on here that's not allowing oxygen to get to the lungs or the heart to get the amount of energy that it needs there. So she's doing great so far. We're clearing all of this out. I'll have you look up for me and back down. And tuck your chin to your chest and relax. And so now we're getting back up by that brainstem area again. There's a little bit more tension on that spinal cord. So we're going to make 2 quick impulses there. And I'll have you push your head straight down into the table and relax. And the other issue with Rachel, I don't do this check a lot on patients, but sometimes I have patients with shoulder issues or elbows or wrist issues. A lot of people out there always think that it's carpal tunnel syndrome. And really, oftentimes it's not. So it can be, again, coming from up here in the elbow or the wrist. So for Rachel, we're going to check that. Which arm was it, Rachel?
The right one.
So I'm going to have you squeeze your elbow and relax there. And she does have a little bit of involvement here within her shoulder blade. So we're going to clear that rotation out. And I'm going to have you squeeze that elbow again. So we're just going to post check and relax. And that cleared great there. I'll have you turn over on your back. So we're going to do one more check here. And this one is for the psoas muscle. So this is a really unique piece of the puzzle for our technique that we use here, but can have a massive difference on the type of release that goes on here. So we're going to stretch both arms. And if you just want to look here, you can see how my thumbs are off here. So she's carrying more tension on this right side. That's a big deal because those muscles are big and they attach to the back here. So they can be pulling one side or the other and affect everything all the way to the top. So that can affect headaches and all sorts of stuff. So we're going to get right here. This one might be a little tender or ticklish sometimes, but right there's a spot that we really need to clear out on her. And then again, the great part about this is we can come back up top and post check, and you can see how that balanced out perfectly there too. So we took that stress out. We cleared everything in that nervous system on the other side. So you can sit up if you want. So she is good to go. That's the adjustment. If you guys have any questions or comments, feel free to comment below. And we'll see you on the next video.